Hello, my name is Dr. Savan Hilo. I'm a urologist here at the Mayo Clinic in Rochester, Minnesota. I specialize in male infertility and sexual medicine. This video will discuss microTESE or microdissection testicular sperm extraction for men with non-obstructive azoospermia. MicroTESE is a special procedure used to look for sperm. Sometimes we can find sperm inside a man's testicles even when it's not in his semen. During this procedure, we'll spend several hours searching for sperm using an operating microscope that magnifies everything so that we can find any areas where sperm might be hiding. We take multiple small samples of tissue from the testicle and send them to the fertility lab to search for sperm that could be used for in vitro fertilization or IVF. Any sperm would need to be used for IVF because the amount of sperm that we would potentially find is small. The goal is to help a couple have a family with the help of IVF. When doing a microTESE to find sperm, there are essentially two ways to go about it. The first is a fresh microTESE, and the second is what we call a frozen microTESE. Both methods are used to help men with no sperm in their semen, but there's a difference in how the sperm is handled. In a fresh microTESE, your partner would undergo an egg retrieval ahead of time. Those eggs would then be frozen and stored anytime prior to the day of your microTESE procedure. During your microTESE, if we find sperm, the eggs that we retrieve from your partner would be thawed so that we could fertilize the sperm and eggs on the day of your microTESE using IVF. In a frozen microTESE, we would perform your microTESE procedure first before retrieving any eggs from your partner. If sperm are found on the day of your microTESE, it would then be frozen and stored for later use. Your partner would then undergo an egg retrieval at a later date, only if we found sperm during your microTESE. While both methods are useful, fresh microTESE does give the advantage of using the sperm immediately. In general, the sperm found at the time of microTESE are not the best quality. Freezing and storing that sperm can further affect the quality to the point that the sperm initially found during your microTESE may not survive the freezing and thawing process and would not be usable later on. The advantage of the frozen microTESE is that your partner doesn't have to undergo an egg retrieval if no sperm is found. Most couples in this situation choose to do a fresh microTESE, but you should pick whichever option you feel most comfortable with. The success rates of microTESE vary depending on a man's health and the reason that he doesn't have sperm in his semen. In general, the success of finding sperm and using it for treatment with in vitro fertilization depends on a number of factors, including your and your partner's age, how healthy the testicles are, and if there are any genetic problems. For many men with non-obstructive azoospermia, microTESE can be successful in finding sperm. For most men, the chance of us finding sperm at the time of a microTESE procedure is about 40 to 50%. It's easy to get caught up on whether or not we're going to find sperm, but the most important measure of success is whether you and your partner are able to have a baby at the end of this process. If sperm is found during microTESE, the chance of taking that sperm and having a baby with in vitro fertilization is about 20%. This is much lower in success rate compared to couples who are performing IVF for a different reason. The reason for this is because the quality of sperm in men with non-obstructive azoospermia is not as good as men who have sperm in their ejaculate. It's important to remember that while the procedure has a good chance of finding sperm, it doesn't always work for everyone, and the success rate can differ based on individual circumstances. MicroTESE is generally considered to be a safe procedure, but like any surgery, it does carry risks and potential complications. These risks are relatively rare, less than 5% for all the risks that I'm about to mention, but you should consider these risks when deciding whether or not to undergo the procedure. Here are the main risks associated with microTESE. First, infection. As with any surgery, there's a risk of infection at the incision or around the testicle itself. This can demonstrate itself as redness, swelling, pain, or discharge from the incision. In this situation, typically we would manage this with antibiotics, but in very rare cases, further surgery may be needed to address deep infections. Second risk is bleeding. Bleeding can occur during the procedure, leading to a hematoma or a collection of blood within the scrotum. This would show as a swelling, bruising, and pain in the scrotal area after surgery. In most cases, a hematoma will get better on its own with rest and ice, but in some cases, it may need to be drained surgically if it causes severe pain or other complications such as infection. The next risk is testicular damage. Although the procedure is very precise, there is a small risk of causing damage to the testicle or surrounding structures. Severe damage could lead to reduced fertility, shrinking of the testicle, or other long-term complications. The surgeon uses advanced microsurgical techniques to minimize this risk, but it's important to understand the potential consequences if damage does occur. The next risk is scarring or fibrosis. The procedure involves making a small incision in the testicle, which could lead to scar tissue inside of the testicle. Scarring can impact future sperm production, although this is generally a minimal risk because the goal of the procedure is to extract viable sperm from areas less affected by damage. Most patients do not experience significant scarring, but it is possible, especially if the testicular tissue is already compromised from other procedures or injuries. Scarring can also affect testosterone production in the long run. The next risk is pain. This would be chronic pain, pain that never quite goes away after surgery. This risk of chronic or prolonged pain can sometimes occur after any testicular surgery. Pain can usually be controlled with medication, and most men experience gradual relief. Chronic pain is quite rare, but should be evaluated if it persists. The last risk is hydrocele. This is a collection of fluid around the testicle or around the scrotum, which can develop after surgery. It feels like swelling or a feeling of fullness in the scrotum. In most cases, a hydrocele will get better on its own, but if it persists, it may require drainage or further surgery. Thank you very much for listening to this video. I hope that you found it helpful. Please feel free to reach out with any questions or concerns during your appointment. Thank you.